If you suffer from back pain and you're considering spine surgery, there are some things that you should know before you make that important decision. Dr. Snyder, she is a neurosurgeon at Barrow Brain and Spine, and she's here to explain when you should and when you should not consider spine surgery. Great to see you.
Thank you for having me.
The first question everybody needs to know is, when do we go to see the spine surgeon?
Yeah, so most Americans suffer from back pain and figure they can deal with it themselves, but really they should see their physicians. Go see your primary care physician. And if you're having difficulty with chronic back or chronic leg pain, your physician might order an MRI of your back or an X-ray. And based on that imaging, they'll send you to see a spine surgeon. And that's one time we should start considering spine surgery.
Yeah, because that was my next question. You know, when do you take that step and say, you know what, I can't live with this pain? Because if you've had back pain, then you know it is debilitating.
It is really debilitating.
I mean, that's a tough decision.
Yeah, so you shouldn't do spine surgery unless you've tried all of the conservative therapies. And conservative therapy includes things like physical therapy, traction, ultrasound, and pain management. And those are really important therapies to start with.
So I have to ask, when you do decide that, you know what, I can't live with this anymore, and you do decide to have this surgery, is spine surgery a long healing process, and is it a long surgery?
You know, it depends on the surgery that's being performed. Sometimes, depending on the surgery, it can be a shorter surgery and a shorter recovery. Now we're doing minimally invasive techniques, which often allow for shorter recoveries and less blood loss. And I wanted to show you some models of the spine to show you what exactly we can do with minimally invasive spine surgery. This is a model of the spine looking at the back, looking at the spine from the back. And usually we have to do a spine surgery where we come from the middle and take all of the muscle down from the midline on both sides to do a fusion. The hardware that you see here is a fusion. But now we don't take down all that muscle and come from the side and just put the hardware in by dilating through the muscle, which is less tissue trauma and less pain after surgery, and thus a faster recovery. This is a model of a spine looking at you from the side. And we can also do spine surgery and do a fusion in another technique coming from the side. And that way you're coming through less muscle, and when you come through less muscle, you have less postoperative pain and, again, faster postoperative recovery.
Are these minimally invasive treatments and procedures, they're not as widely talked about as you would hear the full back surgery?
Sure, and because it depends on the disease process that you have. Some surgery is done for other disease processes that you need a traditional open surgery, but more common things like disc herniations and narrowing of the spinal canal, and where nerve roots are pinched and that sort of thing, those can all be performed using minimally invasive techniques.
And are people finding that the recovery time obviously is going to be a lot shorter for them?
Sure. It depends, again, it depends on the actual disease process that the patient has or what is exactly causing the back pain. But when a minimally invasive procedure can be performed, usually the shorter recovery is common.
Right, and when you see this type of technology, my goodness, how far we've come, right?
Sure,
I mean, you as a neurosurgeon, it must be pretty exciting to see that people have a lot of other options.
Yes, absolutely. The best part of my job is to get to see patients get better. And when they can get better faster and with less pain, that makes it even better.
Yeah, is it less hardware too?
Sometimes it's less hardware, but the biggest thing is the way we get there. And the way we get there can be without as much tissue dissection, then the patients do better.
All right, so get there by going to your surgeon first and finding out the best treatment plan for you. For more information and to schedule a consultation with a Barrow Brain and Spine surgeon, call 602-406-3181. Barrow Brain and Spine is located at 2910 North 3rd Avenue. The phone number is right there on your screen, 602-406-3181.